The NDIS will be a main focus in the May budget. And joining me live is President of People with Disability Australia, Sam Connor. Great to see you, Sam. Good afternoon to you. So, yes, big news and big talk on the budget and, of course, the NDIS. What are your main concerns?
Hi, Janie. Now Vice President, so Nicole Lee has jumped a step up and I've jumped a step down. I guess the main concerns are the narrative that the NDIS can be underfunded. We never ask these questions about Medicare, and say that there's a Medicare blowout, for example. So we're talking about reasonable and necessary support for people with disability. It's not really an option. We need to make sure that people get the help that they need for reasonable and necessary support. And we hope that government commits to making sure that the NDIS is not just fully funded, but operating properly.
And this week, Minister Bill Shorten of the NDIS is calling for the need of better care for schools and mental health systems that do cater with people with disabilities. So the NDIS doesn't balloon, it can return to its original state. Tell us about what it was designed for originally.
I think the best way to describe it is the way that Stella Young described it, which is making sure that people get what they need to be who they are. And so, so for people to participate equally in life, in school and study, in work, some people need help to do that. And that might be a wheelchair, for example. I'm a wheelchair user, or it might be a support worker. And it's making sure that people have got the help to be able to bridge that gap between a disabled life and an ordinary life. And of course, then we've also got, the NDIS is something that also creates work with a huge workforce of nearly 300,000 people. We have a huge return of 52 billion, I think it was, to the economy in 2020 to 2021. And so it's actually a part of our economy as well.
You make a really good point, and I know we've talked about this several times, Sam, but can you extend on that? Because we do hear about, potential funds being cut. We don't often hear about how many workers and how much money this scheme brings into the economy.
Yeah, absolutely. There are concerns that have been raised about price gouging. That I think the same thing happened with the TAC in Victoria. When people know that it's NDIS, then, sometimes the bill will go up. And so there are those concerns about providers charging too much. And, that's something we really need to keep an eye on. But we need to make sure that people with disability are getting the support directly that they need. And they shouldn't be held up by red tape that may be more expensive too. So it shouldn't cost $4,000 for an occupational therapist to get a low budget item that might be $1,000 or so. We really need to make sure that the scheme is functioning as it should be.
I'm reading some surveys and reports, Sam, on the donations dropping, volunteers dropping. Of course, we continue to be in a pandemic. A lot of people, unable to go to work, whether they wanted to volunteer or work or what have you. But so yes, a lot of not only funds but people certainly not able to for their reasons. So what are your main concerns? Because obviously with COVID and people getting potentially sicker in some stages of their life, we're seeing more need.
Yeah, absolutely. And anyone who lives in a country town will tell you that the volunteer workforce isn't necessarily a young one either. So there's people who are at risk of COVID because of their age, and that's seen, some of the volunteer workforce drop off as well. Really, I think we need to find new ways of doing things, and COVID safety is something that we need to look at. We need to look at that in conjunction with our care workforce, our informal care workforce, and making sure that everyone is safe. And I hope that that's part of the budget as well.
All right, and let's give a shout out to the President of Disability Australia, Nicole Lee. How's she doing? Because yeah,
she's doing really well. Yeah, so she's probably leaving my term in the shade, I think, and absolutely smashing it in terms of understanding, what the issues are. Also, a woman who's a wheelchair user and has a family that has lots of different experience with mental health and disability, and I have a great deal of admiration for Nick.
Well, you both do an amazing job. I have my dear sister who passed away a long time ago. I know you and I have spoken about it, and she was a passenger in a car accident and severely brain damage, quadriplegic. So I know firsthand how expensive, how traumatic it can be, and you know, just a little a road or something, if it's not, you know, put the right way and so forth, how much there is and what you have to deal with.
Absolutely. And, you know, I think that's something that people don't understand, that it really does take just a second before your life can change forever. And that can be having a child with a disability as well. We need to make sure that, you know, this isn't an optional thing. This is something like Medicare, that people need healthcare, people need disability care. We need to make sure that government have got a firm focus on making sure people get what they need.
Absolutely. Is autism, I was reading, one of the most diagnosed for NDIS?
It is, but I had a look at the quarterly report today, and funnily enough, it's one of the least expensive. So in terms of the actual diagnostic groups, people with spinal cord injury, as you were saying with your sister, but also people with ABI and people with cerebral palsy, you know, and of course, when you're looking at power chairs and you're looking at high support needs that need 24-hour care and support, very much, you know, something that's cost more than other types of disability care and support, and also SIL and supported disability accommodation, you know, big ticket items. The rest of the people who don't have those disabilities have, you know, quite low funding quite often. And so when you look at average amounts and you look at it being sort of, you know, $55,000, $60,000 or so over that period, it really isn't a lot when you know, compare it to different people. So it really is, it's something that's supposed to be individualised, and hopefully we're able to fund it to keep it that way.
And as you said before, 300,000 workers, it brings so much money into the economy as well. So it sounds like a win-win. I'm no expert, but it sounds pretty simple.
Absolutely, absolutely. And I know that Bill Shorten, who I've had a probably fairly acrimonious relationship over the years, poor Bill, you know, does have a focus on the NDIS and arguably knows, you know, as much about it as anybody else, you know, that has been involved since prior to the inception of the thing and is certainly passionate about it. So let's hope he gets it right, and let's hope that Labor gets it right over this budget.
Well, you continue to get it right, you and Nicole. So thank you so much for joining us, and great to see you, and we'll see you again soon.
Thanks so much, Janie.